I'm Dr. Sebastian Gonzalez with Performance Play Sports Care. In this video, we're going to go over a few tips, 4 tips, to see if your shoulder is healthy enough to actually lift overhead. And this is in correlation to a podcast that we did on lifting overhead. We did one with Max Schenk, and we did one with Dr. Scott Mills. So this will correlate to both of them. Now, the first thing, and it's going to seem very simple, but the first thing we have to do when we are lifting overhead is to test to see if the shoulder is actually able to bear load. And what I mean by that is if your shoulder cannot actually get overhead without pain, why would we stick a weight in it? There's almost no reason to, okay? And it's the simplest thing you could possibly do. Now, there's many different reasons why your shoulder can actually hurt while going overhead, and we're not going to go into that today. But if you cannot go overhead without a weight, you cannot go overhead with a weight. One simple thing you can use actually to see if it's gravity or some type of weight bearing issue is you can try on the ground, which some people, actually this makes them feel better. They lay on the ground, they raise their arm over their head when they're on their back, and it gets better. So in that regard, you might be looking at some type of control issue, and it might not be a tear. Now, second thing we want to see is actually on that same note is that if our shoulder blade can't get in the right position to bear the weight, then it's going to actually irritate the rotator cuff, which that's where a lot of cuff tears come from in shoulder impingement. So you can use something like this, which actually we test when we have patients in the office, is if we have them seated, and if they can't raise their arm over their head without pain, sometimes we'll just take our hand and press into this region that we're at right now and have them raise their arm overhead. And a lot of times it goes away, which means that there's a positional issue. It's not that there's a large-scale tear. So if that does work, then we use something like this, which they can then repattern shoulder blade motion while they're not in the office with us. So this drives down. You want to make sure to set the shoulder blades back and not so they're rounded forward. Okay? You can go into flexion, or you can go into this direction. So both of them are okay. If you have a decrease in pain with this, then it's something you should add to your warm-up, okay? Now, if we're looking at an issue with strength, I will show just after this one how to address something like a serratus anterior strength issue, because it could be a patterning issue, it could be a strength issue, it could be a tear. There could be a lot of reasons why your shoulder is not functioning well. Now, when we're talking about lifting overhead with Olympic lifts, we have to consider the possibility that the shoulder is being loaded because our bar path is not correct, okay? And looking from the side here, we usually want the bar path, no matter where it's at, to be roughly in this range right here. If it goes too far forward or too far back, then we're going to run into some issues. So a good way to test this to see if your ankles are an issue is to do an overhead squat test. Now, you're going to notice that for me, I'm not perfect. So at this point, if we drop this bar, I'm starting to come over my toes. The bar path is over my toes. Versus right here, it should be over my ear, over my shoulder, over my hips, and over the middle of my foot. Okay, and at some point, I'm going to start losing that. Okay? Now, if you can make a simple correction by going on to a couple lifts. Now, these weights aren't perfect because you see they slide around, but even if you had a mat, if you had lifting shoes, there's a lot of possibilities of things you can add. But as you see when I come onto this, I'm going to show you how much motion I have now to keep the bar path over the middle of the foot versus without some assistance. So that could be a simple correction, because when you get too far out forward, then you're going to load the shoulder blade, or you're going to load the rotator cuff, and you're eventually going to tear it, because if you're putting that much weight over your head and loading only your rotator cuff, those things are tiny muscles. They're not designed to do that. They're designed to keep the ball and socket in the socket together. Now lastly, if there's a strength issue, we're going to use this foam roll, and I'll show you how to do it right here. Now, this is called a Serratus wall slide, and you don't need to have nubs on the roller. It's just the one that I happen to have here. So a standard foam roller will work. I like to put it right around eye height. Wrist right on top there, and you notice that this puts my my biceps or my arms into basically they're parallel to the ground, okay? Now in this position, you want to make sure the person is not leaning into it, okay? And also, if you look at my shoulder blades, sometimes people sink in like this. I usually cue them and I put my hand right there in the middle of their back and I tell them to press and fill that space for me, okay? So for here, you're going to keep that space pressed and full and slide the hands up the wall with just a little pressure on that roller. And if you look at my shoulder blade on the left here, really what I'm doing is I'm forcing that thing through this way, okay? And a common fault I see people do is they get up here and then all of a sudden they extend the elbows, okay? It's not an elbow extension exercise. It's an exercise which assists with rotating these shoulder blades through. So we're trying to improve how the serratus anterior is working with these people with scapular dyskinesis or sick scapula syndrome. So if you have questions on this any further, you should listen to the podcast we have correlated with this. Subscribe to the channel, share it with friends. Most of the stuff, we spend an hour on it in the podcast. And there's 2 different podcasts on it. So you'll learn a lot from it. These exercises will help you greatly. Subscribe and I'll talk to you later.